Hi everybody, it's Christina. We're trying out a new background today. I don't know if I like it. But anyway, I mentioned in my last video that I was going to make this next video about some of the associated conditions that I have, as well as Ehlers-Danlos syndrome. And as I started to write the script for that, I was kind of planning it to be more of an overview of everything. But I very quickly realized that that wasn't going to work and that we're going to have to probably take things one at a time. So today I wanted to talk about one of the associated conditions that I feel is the most common, not only with people with EDS, but also people with other chronic illnesses, and that is POTS. Now, I did touch on this a little bit in my last video. I was diagnosed with POTS in 2013, the same day that I was diagnosed with EDS. My geneticist was worried about the structural integrity of my heart, so she sent me directly across the hall to her colleague who was a cardiologist, and that was when I was diagnosed with POTS. Although I do believe that I have been experiencing symptoms since probably as early as I can remember. So what is POTS? POTS is Postural Orthostatic Tachycardia syndrome. It is a form of dysautonomia that's characterized by a dramatic increase in heart rate due to postural changes. Dysautonomia is an umbrella term for a group of disorders that cause dysfunction or dysregulation of the autonomic nervous system. The autonomic nervous system is responsible for regulating the functions that you don't necessarily control or direct, such as breathing, heart rate, and digestion. POTS is often diagnosed using a tilt table test, but when a tilt table test is not available or the patient is unable to tolerate it, your doctor can perform what they call a poor man's tilt table test, which is how I was diagnosed. During a poor man's tilt table test, the doctor will take your heart rate and blood pressure while lying down, then sitting up, from sitting to standing, and then after 5 or 10 minutes of standing. POTS is diagnosed when a patient's heart rate increases 30 beats per minute or more, or to over 120 beats per minute within the first 10 minutes of standing. In my case, my heart rate increased about 80 beats per minute and was well over 120 beats per minute, so my doctor and I decided that there really wasn't any need to proceed with a real tilt table test. It's important to note that POTS can be accompanied by a dramatic drop in blood pressure or orthostatic hypotension, but that is not part of the diagnostic criteria. Besides that feeling of your heart racing in your chest and having palpitations, patients also suffer from severe fatigue, lightheadedness, sweating, nausea, vomiting, fainting, brain fog, confusion, coldness, chills, chest pain, trouble breathing, and exercise intolerance. I mean, it really affects everything, and I can definitely attest to all of these symptoms. POTS is not just seen in conjunction with EDS. It also goes along with a lot of other chronic or invisible illnesses, as well as being seen on its own. And it is relatively common, especially in preteen and teenaged girls. Luckily, many people will outgrow it as they grow older and their hormones start to even out, but unfortunately, EDS patients aren't always that lucky. Because our veins and ligaments are so loose and our nerves tend to misfire, our bodies often have quite a bit of trouble pumping blood to all of your internal organs and up to your brain. As soon as you sit or stand up, gravity takes over and all the blood just rushes and pools into the lower extremities. And let me tell you, as soon as you start to lift your arms above shoulder height, your heart has to work just that much harder. I cannot tell you how many times I have blacked out styling my hair. So be careful, especially in the shower. Some people find that wearing compression stockings or socks or an abdominal binder really helps them manage their symptoms. I really do recommend these products. Unfortunately for me, it's not really enough, but they are really helpful in my overall management. I do have to warn you that they're pretty hot and pretty uncomfortable and really hard to get on. So expect to maybe dislocate a finger or two trying to pull on some compression socks. I personally believe that I started to show some signs and symptoms as early as kindergarten or first grade, but we mistook them at first for asthma attacks. And that was kind of an easy mistake to make because I do also have asthma. Right about age 11 is when I started to have these attacks more often, and most of them were in gym class. I remember the first day of 6th grade, and the very first day of gym class, the gym teacher had us running laps. And right away I started to feel really hot and dizzy and nauseous, and I had a hard time breathing. I couldn't catch my breath. I had to sit on the floor. I was like, oh no, I'm going to be that person who throws up in the first day of 6th grade. This is going to follow me forever. So I went to the school nurse, and she decided that this was one of my asthma attacks. After that, I had to start taking my inhaler 15 minutes before gym, and that made it much worse. And now I know why. Now I know that the albuterol inhaler I was using was actually increasing my heart rate further. I was also really famous in my family for having these attacks anytime we tried to go shopping. I would get halfway through a shopping trip and all of a sudden I had it. I was hot, I was dizzy, I was nauseous. I needed to sit on the floor and I needed to go home. We knew that basically anytime I set foot in a store or a mall that I was probably going to have some kind of meltdown. You just could not bring me anywhere. It wasn't until I was about 16 or 17 and had just had major surgery that it became pretty apparent that something was really going on here. I felt lightheaded all the time. I started fainting. I was vomiting. I felt confused. I couldn't think, which is really not me. And I was having a really hard time catching my breath. At one point, it became so severe that if I even tried to sit up or lift my head up in bed, I would faint. Every time I have surgery, I know that I can expect a flare afterwards. And that's really just something that we consider as part of the normal recovery for me. Temperature, hormones, environmental changes, surgery, illness, and stress are all things that can cause flare-ups. Once I received my diagnosis, it made a lot of sense, and it explained a lot of the symptoms that I had been feeling my whole life. My cardiologist started me on a low-dose beta blocker to try to bring down my heart rate. And that did really help me at the beginning, but it just wasn't enough. So we tried to up the beta blocker, and as soon as we did that, I started fainting worse than I had before. And we realized that it was really dropping my blood pressure. It's a really delicate balance between heart rate and blood pressure, and oftentimes you can't really treat POTS unless you also address the blood pressure. I have now been on these two medications for a few years, and I can say that they have made a huge difference in my life, but they are definitely not a miracle cure. There are a lot of side effects from the medications that I'm still experiencing today. Adopting a high salt diet and increasing my fluid consumption has been another very important part of managing my POTS. In fact, some patients find that they can mostly manage their symptoms through diet alone, while other patients may end up needing frequent IV saline treatments to increase their blood volume, increase their fluid and salt intake. POTS and dysautonomia in general can range from really very mild to severely debilitating, and sometimes it can be both for the same patient over their lifetime. Some patients are capable of living completely normal lives, while others are permanently disabled by their symptoms. It really depends on the person. Right now, to be completely honest, I'm going through a flare-up that seems to have kind of gone beyond POTS. I'm having increasing issues with my temperature regulation, my blood pressure, my heart rate, my adrenal function, and my oxygen saturation. These are not normal POTS symptoms. If you're also experiencing these symptoms, you may want to look into a diagnosis of a more generalized autonomic dysfunction, as POTS really just addresses the heart rate. I think a lot of it has to do with the fact that I'm really not getting a lot of salt in my diet since I've had to transfer to tube feeding. If there are any other tubies out there who can give me some tips on how to increase my salt intake without all of the artificial coloring and dyes of Gatorades or other sports drinks, that would be really appreciated. I'm kind of new at this. Thank you so much for watching. If you liked this video, please give it a thumbs up or comment below. That way I know that you want to see more videos like this. And also comment or message me with any video ideas for what you might like to see next. And I'll see you in my next video. Goodbye.